Hello. I'm just going to briefly go through the talks that we had this morning, which were all wonderful and had lots of information. So, starting with Keith, the key point that we got from that talk was the importance of communication and the important message to all clinicians to refer when best for their patient. Then, when we move on to Steve, he showed how cataract removal can be beneficial, although the visual results can be limited because of the other problems that are associated with aniridia. So there are also corneal problems and glaucoma, but removal of cataract can be beneficial, but it is important to weigh up the risks and benefits. Iris implants may or may not be beneficial, and there needs to be long-term data on that. Then when we move on to Jay's talk, he went through how nystagmus can often be the first presenting feature of aniridia and how that often triggers investigations for a diagnosis of aniridia by testing for the PAX6 gene mutation. He also went through possible treatment options that generically apply to nystagmus but can also apply in aniridia, and that included things like contact lenses, possibly medications, depending on the situation, squint or head posture surgery. And then Dominique gave a lovely presentation showing the variations in aniridia that can present depending on the genetic mutation, demonstrating how it can vary across the same family and how it affects every structure of the eye, from the cornea right through to the iris, the lens, with cataract development and glaucoma. And it was really interesting to see the guidelines that have been developed locally for aniridia. And it would be nice to see that actually distributed more widely. We have several additional panel speakers who will be joining us for the Q&A, and that includes some well-known experts in their fields. So that includes Maria Musiji, whose name you hear and you immediately associate with expertise in glaucoma, and Saj Ahmed, who has a special expertise in cornea and stem cell deficiency. So please do make use of the expertise on the panel. So I guess we move on to panel questions?